cycle of contraction and relaxation. The QT interval represents a single ventricular cycle of contraction and relaxation. The Q of the QRS complex represents the beginning of ventricular activation and contraction, and the T wave represents ventricular relaxation and repolarization. Together, the QT interval describes the time that this entire process takes. Now, speaking of time, what are the acceptable intervals for this measure? Well, broadly speaking, the QT interval should be less than half of the R to R interval, and more specifically, the QTI should be less than 0.44 seconds in men and less than 0.46 seconds in women. We can see this here. Women are known to have longer QT intervals when corrected for rate as compared to their male counterparts, but the mechanism is not fully understood. Fortunately, though, it's not an absolute predictor for cardiac arrhythmias. Long QT syndrome, which we see here, may be hereditary, electrolyte-induced, or drug-induced. In fact, medications with antiarrhythmic properties like sotalol, flecainide, amiodarone, and some others have the potential to prolong this interval. Patients that are undergoing loading therapies for these drug types often have their QT intervals measured using serial ECGs. And if you notice that the QT interval is approaching or exceeding 0.5 seconds or 500 milliseconds, you should notify the provider. If it's left untreated, long QT syndrome predisposes people to a potentially lethal form of ventricular tachycardia known as torsade de poids, which translates to a twisting of the points, which we can see here. It's also said to represent a party streamer of sorts. So if a PVC or another early beat were to strike the T wave while the ventricles were refractory and repolarizing, the heart can be thrown into this electrically chaotic state where cardiac output has the potential to fall dramatically. And remember, the major reason why we care about any of these cardiac arrhythmias is the effect that they have on total cardiac output. So be on the lookout for the medications that you see listed here. They're commonly known to prolong the QT interval, but just be aware that it's not a conclusive list. So take-home points related to the QT interval are that it represents a single ventricular cycle of contraction and relaxation. Number 2, the QT interval should be less than half the R to R interval, generally speaking, but more specifically, it should be less than 0.44 seconds in men and less than 0.46 seconds in women. Number 3, long QT syndrome predisposes patients to a potentially lethal form of ventricular tachycardia known as torsade de poids. And finally, long QT syndrome may be hereditary, may be electrolyte-induced, or it can be drug-induced.